Hey everybody, Dr. Perry from Stop Chasing Pain with another video. Hopefully it's going to help you decrease pain, decrease stress, decrease inflammation, feel better, and heal. This time we're going to talk about the power of the ear, rubbing the ear and pulling the ear. We're going to move into showing you the neurology and physiology of why these techniques can help you. And then we'll show you a little snippet of a video of me doing it on someone from one of my workshops. This is the Vegas Mojo workshop that we teach. And then I come on camera after that and show you how you can do some of these techniques to yourself. Okay, so let's move right on into it. All right. So what in the world is this freaky thing you're looking at here? Well, I mean, that's an ear, and superimposed over the ear is, yes, you are correct. That is an upside down fetus. So that is from the world of auriculotherapy. Auriculo just means ear, and therapy is something that they do a lot of in Eastern medicine and acupuncture. You can drop needles in those things. Some people will put the little um, pellets that are taped on those regions. I use an acupuncture laser on those regions. And basically, what that correlates to is that the parts of the ear, when you stimulate them, it may help the part of the body that's represented on the fetus. So, for instance, the lobe down here is always represented with the brain region. The Around the ear hole here, your ear canal, and this part of your ear is to the internal organs. And around this helix here on the outside is for your spine. This part in the front is called your tragus. You may be able to see it over here. That's a really important point to help with stress, anxiety, and calming the body down. And you're going to see me like rubbing all over the ear right here. Okay, so you're also going to have a lot of neurology tied to the ear. If you look at this picture on the right, you can see you're going to have different innervation of this coming from branches of what they call cranial nerves. You're going to see that in a moment. I want you to pay attention to this inside part right here. It's in darker blue, and that's going to be correlated to your vagus nerve. And why is that important? Because the vagus nerve is a cranial nerve that comes off of your brainstem, particularly your medulla. You have a left one, you have a right one. And the vagus nerve is the most powerful nerve in the body to control inflammation and also the parasympathetic relaxation, heal, recovery, and regenerate state. So, what does that mean? If you rub and stimulate this part of the ear, well, then maybe you can feed back into that vagus nerve and improve the function of the vagus nerve, which will help you relax. All right. Now, here's a slide uh, that I'm going to show you. And this is from Jean-Pierre Barral. He's been very, very influential in my work. He's a doctor of osteopathy, and he is known as the founder of visceral manipulation, which is a practice that as well. It's taking the viscera, which are your organs, and moving them around. That's visceral manipulation. Okay. And here's just another picture representing what you saw on the previous one of different sections of the ear innervated by different cranial nerves. And I'm going to read this paragraph over on the right. And I know it may look like gobbledygook to a lot of you if you don't understand the words, and I'll break it down and explain it to you and make it really simple. The techniques for the external auditory meatus, that's your ear hole. That's where you like stick a Q-tip, have a major effect on the facial nerve. That's cranial nerve number 7. We'll talk about that in a little bit, but that's the nerves that are going to move the muscles of the face, basically, so you can smile and make all these sorts of different faces. And it's anastomosis. Anastomosis just means connects to, influenced by. So basically, they kind of work together. All right. With the vagus, and that's the cranial nerve number 10 that we told you about before, and the trigeminal nerves. And that's a really important nerve, everybody. We're going to show you when we talk about the brainstem, because that's a nerve that's tied to the chewing muscles of mastication. I'll review those in a second. And also sensation to the face, what you feel. But also you need to know that these nerves here are going to have a lot to do with the tongue. And I've talked a lot about the tongue in the past. If you haven't seen my tongue videos, just type in tongue under the search button and then stop chasing pain, and you'll see a lot of them show up and you can start doing those. But simply put, what that means is working the ear hole makes you feel better, right? And that's what you're going to do here with these ear pulling techniques. We're going to show you how to pull the lobe of the ear down, out, and up. And we'll show you a couple of additional ones at the end of how to move the rest of the ear. Extremely powerful. I think you'll notice it is a technique that will relax you right away. So that's pretty great. Now, let me just show you another picture here. This is just the acupressure, acupuncture, neural stimulation points where people can drop needles or the little pellets that are taped to you. And these are places that can work with the body. And what I want you to notice is up in the front here is this tragus area. That's a big relaxation point. And anything inside this section of the ear here, when you rub there, you're going to affect your organs. Extremely powerful region to work. And you'll see where we do the finger technique in the ear to change that. I also want to show you this one, which is a fantastic view of the ear canal. So imagine that you're looking straight at someone's face. And so this would be their right side, right ear. You're looking at them. And this is your external auditory meatus, if you see my mouse moving around. And it's going to come back in here and go down to the ear canal. And then this blue structure here is your vestibular system. So this system we've talked about in the past on prior videos. This is an extremely powerful system that will be tied to your overall stress response. If you have vestibular issues, you will likely be locked in sympathetic dominant fight or flight hypervigilance, because your brain has a hard time determining where you're going and which way is up. And that's what this apparatus does. So if you're not oriented well, it's extremely stressful for your nervous system. And if you've had vestibular issues, you know it's very difficult to function, right? What I want you to pay attention to here is this. Inside that ear canal, you have those nerves that we're going to show you coming off the brainstem that supply this part. So that means when you do anything to stretch this area, move this area, or touch this area, that feeds back into the brainstem and affects those cranial nerves and how well they function. So the ear canal, right, is like a circular tube. And what I want you to look at first is this posterior part. So posterior just means the back. So this is the back part of the canal. The back superior upper part is innervated by the facial nerve. The posterior lower part, inferior part, is by the vagus nerve. And this anterior part, which is not here because we shaved the anterior part off so you could see the back. So it's basically like a half pipe view here that you're seeing. That anterior section, which is removed from here, the top and the bottom, is innervated by the trigeminal nerve. All three of these nerves are extremely powerful in relaxing your nervous system and taking you out of stress, fight, or flight. That's why working with your ear is no joke. All right. You're just going to see me rubbing the ear and pulling the ear. And initially, it looks like, what in the world can that do, Doc? Seriously? I mean, it looks like it can't do anything. Well, now you're going to know why. It's really powerful. And you're going to do it and then experience the difference. And if you work with patients and clients in chronic pain, you should do it to them or teach it how to do themselves. And I want you to show other people in your life how to do these things as well. So let's talk about those cranial nerves really fast. I love to talk about cranial nerves because they come right off of your brain stem in the back, all right? And you have 12 cranial nerves on the left, 12 on the right. So ultimately, you actually have 24 of them. And these are the ones that are really going to control primary things that you do. Like, can you smell stuff? Can you see stuff? Can you hear stuff? Can you feel stuff on your face? Can you taste things? Movement of your tongue? These are high value targets in neurology. And when you work with them, they can significantly impact your state of stress, relaxation, and inflammation. All right. Now, the ones that we're going to focus on here, particularly when you rub the ear and pull the ear, is that trigeminal nerve, cranial nerve number 5, and that's going to come off your pons. If you look at this thing, it almost looks like a little bit of a cauliflower in a way. You've got one on the right side, one on the left side. So this is if you're looking in the back of someone's neck. And look how thick that is. That is a huge nerve. And the trigeminal nerve does a couple things. It controls the muscles of mastication. Those are your chewer muscles. So your temple muscle, your masseter muscle right here, and it's going to get what's called your pterygoid muscles that are deep inside. And we show you how to work the pterygoids in our Dr. Evil video. Make sure you go check that out. And they have sensation to the face, facial sensation. And now you'll see part of the ear. And then the facial nerve itself is going to hit the ones for moving the facial muscles and also inside that ear canal. And then cranial nerve number 10 in particular, the vagus nerve, which we said before is the most important nerve in the body to control the inflammatory response and relaxation. And it's the visceral gut organ control one as well. Now, what you need to realize is that when nerves are next to each other, they talk to each other. Now, anytime that you're going to stimulate this trigeminal, you'll also stimulate your abducens nerve, which is a nerve that's going to move your eye. Then the trochlear nerve above that is another nerve that's going to move your eye. And then number 7, 6 next to number 8, that's the vestibulocochlear nerve. Vestibular is vestibular. All right. So this is going to be your balance and hearing type nerve. And then the cranial nerve number 10 will influence number 9. Glosso means tongue, pharyngeal means pharynx. So that's a huge player in relationship to anything in the head, neck, and face. All right. And then the accessory nerve that's sit next to that is the nerve that is a motor nerve to your trapezius muscle, so you can raise and lower your shoulder, and your sternocleidomastoid muscle, the one muscle that sits in your neck that gets really tight. And whenever you turn your head, you see that pop out. And here's another view of those from the side. So I'm looking at a side view. You can see the same nerves where they are located. And up at the top here, that's your midbrain. Then this is your pons, and this is your medulla right there. Okay? So the takeaway is there's a lot of stuff that's going to be happening here when you see me pull the ear, rub the ear, do these sorts of things. And I think you're going to feel absolutely fantastic on these. I'm going to give you a few things to pay attention to. Nothing should hurt when you do these. If it does, usually you have to lighten up how hard you're going, and eventually, if it's painful or uncomfortable, it should ease up. If the more you do these, the pain does not dissipate, stop. These are not meant for you. Okay. Remember, you don't have to do it a ton either. Our mantra is more isn't better, better is better, especially when you're dealing with neurology. There's a lot of inputs coming into the brain, and you can overload it quick, fast, and in a hurry. Always make sure you do both sides. It doesn't matter which one you do first, as long as you do both sides. Also, pay attention to breathing. Make sure that you never, ever stop breathing, preferably mouth closed, teeth together, tip, middle, and back of the tongue at the roof of the mouth. That's going to help center your head over your torso, adequately open up your airway, and get more oxygen to the lower one-third of your lungs, and help dilate your blood vessels more because you're using your nose, not your mouth. And make sure that you don't hold your breath. Okay. Holding your breath is a sign of stress. So if you hold your breath and you can't do these without holding your breath, you need to back off and relax. Again, you can do these in any position you want, standing, lying down, seated. Each one will be a little bit different in how they impact your nervous system. Okay? And you can pull your ear every single day of your life. That would be a good thing. Your ears will be really, really happy. I know because they told me. All right. So, with that, how about we move into the video demonstrations? Here we go.
The first one you're going to do is where you're going to take a finger and you're going to hook it behind what's called the tragus, this one. But I want you to go in so you can hook really close to the bone right there. I don't want you to just on that tip. I want you deep so I can pull forward this way. You'll know it when you feel it. I don't want you to go too far in because you're going to push against the bone. It's just above the bone. And what you're going to end up doing is pressing forward towards the cheek. And you got a couple different ways you can do that. I'm going to take this finger here. I'm going to go and then push forward like that. And I'll hold that for 30 seconds. And they'll feel that stretching on the inside of the ear canal, but it shouldn't hurt. Another version is I can take my finger over the top. I can hook in this way and then pull forward. See how much pull I'm doing there? No pain, right?
No.
So that's a pretty good amount of pressure I'm putting in there. Whichever one you prefer. And then slowly let go. Then the last one, I'm going to grab the bottom of the earlobe. I'm going to pull down towards the collarbone and hold a few seconds. And then I'm going to slowly pull the earlobe away from the jawline like this. So it looks like that. And I'm going to hold that for a few seconds. And they'll feel a big stretch on the inside of that ear canal. Okay. You're going to be stimulating a lot of nerves in there when you do that, from your facial nerve, your trigeminal nerve, and your vagus nerve that are innervating the inside of that ear. So that'll help you relax.
All right. Now let's go over how to do those to yourself, and I'm going to add some extra ones to do to yourself as well. I'm going to zero in just on one ear first so you can just see the general technique. You're more than welcome to do both ears at the same time if you like to, or you go from one to the other. It's really up to you. Often I like to do one at a time because you get a better sense of the feeling of your body because you're not overloaded with too much sensation. So do one side and notice, okay, what do I feel here? Tightness, tension, pain, pulling, and then go to the other side and notice what you feel there. And then you can work into both at the same time. All right. So what can we do? Let's just talk about rubbing the ear and what they call ear unfolding. You're going to just gently start massaging around the ear. I really don't care where you start, but I'm going to start down here and really gently rub and massage. And you see these little creases around here? I'm going to unfold those. Okay. It's like you're rolling them open, then massage. Go towards the top. Do the same thing. Come forward here. Now you can also just kind of cross over and use two if you like. I'll try to hit the camera angle as best I can. Grab this called your tragus. Rub your tragus. Pinch and grab your tragus. And then now we're going to go inside these little spaces here. Put your finger in, start rubbing. Get your nail across it a little bit, but don't cause any pain. Get all up in the inside. Press in and do a little what they call acupressure. Just like that. and then come up more towards the top, right in here. And then, just, there's no magical perfect time frame to do that. Just whatever you feel comfortable with or whatever time frame you can spare. So that's like rubbing, acupressure, and the unfolding. Now we're going to talk about pulls. We're going to pull in different places. The first one I'm going to show you is that tragus pull, like you saw me doing to someone on the video. And you've got your earlobe pull down and out. And we'll work our way around now, and I'll show you a couple of extra pulls. This is going to feel really, really good. I'm excited to do this one. Let's talk about the tragus pull. A couple different ways you can do it. I actually like to hook my thumb behind that tragus. Remember, do not go too far into the ear canal where you're hooking the bone, because it's going to hurt. You're just going to hook that soft tissue kind of cartilage part of that tragus and pull forward. So I'll go put my thumb in here and I'll just do this with it like that. I'll go here. I can put my hands right here as a grip fulcrum point, and I'm going to pull forward like that with my thumb and hold. Breathe in and out through your nose. Don't pull too hard that it really, really hurts. Some people actually like to use the finger in here and push forward that way. I didn't mean to flick off there. Whatever you're comfortable with. Now let's go down to the ear pull here. Grab the earlobe, pull straight down, feel the tension deep inside of that ear canal. Then pull directly away from your face like that. You'll really feel the tension in that ear canal. Hold. And if you like at the end, you can curl up a little bit like that, pulling towards the sky/ceiling. So it's kind of like down, out, hook up like that. Then what I like to do is put my finger one inside here, one here. Then I'll pull directly away from the center of the ear. Hold. Pull directly backwards. Then up. To here, I'll hook up underneath. Grab here, pull up. And then also grab that part and lift straight up and pull back a little bit. So I'm going to go up and then arch backwards. Okay. Oh, that side feels absolutely magnificent. This side is really, really jealous. So I'm going to do this side for two reasons. One, my ear really, really wants me to do it. And two, I want you to experience it again, how to go through it. Okay, here's the sequence for the other side. Let's go through it. Rubbing. Grab down at the bottom of the earlobe, lightly massage. Work your way up and around the ear, unrolling, unfolding. Go up near the top. I'm going to try to scoop over with my other hand so you can actually see it like this. Remember, we can do the two together. Put your finger inside that ear. Start rubbing back and forth, scraping, some acupressure. Hook and push forward, just like that. Feels really good in there. Okay, I want to make sure you can still see what I'm doing. And rub. Rubbing, unfolding, and pressure. Okay, and you also want to grab that tragus. So the tragus sits right here. I'll try the other one. Pinch and grab it like this. Rub, squeeze, and hold. That's a good one to hold for 20 seconds or so. Big stress reduction relaxation point of the ear. Now let's talk about pulls. If I'm going to hook the thumb right in that tragus. I'll plant my fingers along my face as a fulcrum, pull forward like that, and hold. Again, remember you can use your finger like that and relax. Earlobe pull. Grab, straight down, pull away from the face, really going that stretch inside the ear canal. Hook up a little bit. Oh, just like that. Grab, pull down, pull away, pull away. I'm going to use my other hand so you can see. Pull up, up, away. Then if I grab here, pull up and backwards. Whew. Perfect. Then I like to end with a little bit of warmth over the ears, kind of like ear muffs in the winter when it's cold. Going to slap your hands together 3 times and then rub. Get a lot of friction in there, building up the heat. Really fast. Oh, that's good. Now take these and cup them over your ears like this. Close your eyes. Close your mouth. Tip of the tongue, middle of the tongue, back of the tongue, up to the roof of the mouth. Breathe slowly in through your nose for about 4 seconds. And then exhale out for 6 seconds, either through your nose or through your mouth. Do that like 3 or 4 breath cycles. You can certainly go back, get your hands warm again as you do that. That feels really, really good. And I'll give you an extra bonus one on the hands for warmth. Slap, rub. Place one on your forehead and one underneath the back of the head. And hold that for 20 to 30 seconds as you breathe. That feels really, really nice. Or you can put both of your hands underneath the back of your head like that, whatever you like. And breathe. You can do this while you're seated. You can do it lying down, standing up, whatever you like. Okay. Very, very good for stress reduction, calming the body, opening up the ears, clearing out the ear canals. And I'll tell you, man, I feel lit up like a Christmas tree. I'm like, neurologically, my brain is like, I feel less stressed, but I feel like, let's go. Let's tear it up. Do that once a day. Try that for 30 days. See how you feel. Please feel free to share some comments or feedback on the things that you experience. And remember, don't cause pain when you do it. Don't overthink it. Explore, play. Remember the neurology of what you're impacting when you do this to make a huge change and how you feel and the quality of your life. And I think that you'll notice you can have some decrease in pain or discomfort almost everywhere in the body. Thanks so much, everybody, as always, for tuning in to the video for Stop Chasing Pain. Dr. Perry. We'll see you soon on the next video.